Welcome to this video lecture. This is the third lecture in the series on data analytics for personalized and optimal therapy. So we continue the theme of RGS therapy that was discussed in lecture 2. And we saw there what the aims and objectives were of the data analytics work. And we saw that various aspects of recovery could be predicted on the basis of mathematical and statistical modeling. And now the question is, how can we use this in decision support and in feeding information back to patients? And I remind you of this recovery diagram where we saw that if we introduce treatment, then the characteristics of the treatment determine where you are along this curve. And that's clearly an optimal point here. So we saw that it's on this basis possible to find out for an individual what would be the optimal treatment for this individual. And if we can make these predictions and as a result also predict what is the likely thing to happen for a patient that uses the optimal therapy, then of course this brings enormous benefits to the various people that are involved in having strokes or in treating people with strokes. For health service providers, it is obviously important in terms of resource allocation, because if we can see who benefits most from therapy and how long therapy should last, then we can use our resources effectively. For therapists, it is of course very valuable to know what the best therapy settings for a given patient is. For instance, the duration, the frequency, which type of RGS activity a patient should engage in. And similarly for patients, it would provide coaching with concrete goals. A patient would see exactly where they are now, what level of recovery would in principle be within reach, and how certain aspects of how to engage with their treatment, how that impacts upon their path to recovery. And there are various levels of information that can be fed to the patients and to the therapists. For instance, the first would be one can compute on the basis of the analytical work what would be the probability of response to treatment of a patient in the first place. What is the likelihood that they derive benefit from it? And this is again based on the parameters and the characteristics of the individuals that were extracted from the data. And of course, if the non-response probability is significantly higher than the response probability, this is an indicator that perhaps there is no point engaging with the RGS system. But if it would be like this, then there is a significant probability of a response, and one would engage with the RGS system. Then if we look further and think in terms of this diagram that I showed you, then there is clearly a distinction between two possible situations, namely the situation where there may be only short-term benefit from therapy, and this is a situation where there is only one cycle, and temporarily we could perhaps move a patient in a region where there are two cycles, the vicious and the virtuous. But after therapy, if they revert back to the one cycle regime, then there would be no point in therapy. Either because the patients would already be in the regime where there's only the virtuous cycle, so the patient would already recover even without therapy, or they would be in a regime where there's only the vicious cycle, and they would always end up in this regime of only the vicious cycle given their parameters. Also here there would be no benefit from therapy, because the patient would always at most have a short-term beneficial impact, but he would relapse immediately afterwards. Now the regime where there will be long-term benefit is clearly the one where there are in principle two cycles. So where the point of the therapy is to move the patient away from the vicious cycle into the virtuous cycle. And once they are there, they would stay there. And this is shown in this diagram where we see, for instance, for an individual, two possible situations. It could be that there's only the yellow curve, which shows that there is only one potential value for the score and the distribution around this, so that can only be one cycle. And this one cycle here happens to be a virtuous cycle because the level of performance is relatively high. If this is the case, you would not give therapy because the patient would already recover independently of therapy. However, if we have a situation like this, then there are two possible stationary states the patient could be in: the low performance stationary state and the high performance stationary state. And the point of the therapy will be to move a patient from here into here. And if that is successful, because this is a stable state, the patient will stay there. And we can feed back this type of information to the patients and to the therapists. And there are various ways of doing this. For instance, we could calculate on the basis of the characteristics of the patient the probability that they will derive long-term benefit. And in this example, that would be 70%, and 30% the probability that they only would derive short-term benefit. And there's another number which is useful, and that is this number DF, which is nothing but the difference in performance between being in the recovery situation and being in the deterioration situation. So this tells you what the gain is of the potential long-term benefit, whereas these color-coded arcs give you the probability that this is indeed going to happen. We can represent this information in other ways. For instance, a patient which is currently at a performance level on the clinical scale 41, we could show them what would be the potential level they could achieve if they ended up in the recovery cycle, or if they ended up in the vicious cycle, they would have a performance level only here at level 25. So a patient would see directly where they are relative to the two possible end situations, one of them being desirable, the other one being very undesirable. And in coaching, we could use all this information. We could feed back the distance to the self-recovery threshold, for instance, which is this separating line between the virtuous and the vicious cycle. For instance, we could indicate this number, and in this case, for instance, this would be the level 5.4, the level of performance measured in certain units in the game. This is the critical level beyond which we are more likely to move in the virtuous cycle. So we could feed back to a patient what their previous day's use on the RGS therapy system would be relative to the level that they would need to move more likely towards the virtuous cycle. And here, for instance, this would describe a situation where the previous day they did not use the system enough, so the performance was significantly below the level they need to move towards the virtuous cycle. Here, they happened to do more than what was needed in order to cross the boundary between the virtuous and the vicious cycle. Similarly, you could also give feedback on the predicted revalidation score after a certain number of weeks or months, given that they carry out their therapy at the current level, which could also act as a motivation in terms of the coaching aims. Now, for therapists and patients, one of the key outcomes of the analysis, given we have extracted the parameters of the patients, we know their individual characteristics, is the personalized optimal RGS protocol. So this would be based on the data, and it would define in great detail the optimal therapy in terms of duration, in terms of intensity, in terms of the type of RGS activity that the patient should be doing. And we can then show again what would be the benefit of this optimal therapy. For instance, we could see that the probability to be recovering, to end up in the virtuous cycle, if a patient does the optimal therapy, would be significantly larger, in this example 68%, than the probability that they would end up in the virtuous cycle if they would not do the therapy, which in this case is 32%. And again, this DF gives you the gain, the difference between performance at the stationary state of the virtuous cycle and the performance at the stationary state of the vicious cycle. So this number tells you the difference between the two, the gain in performance for the patient, and these numbers tell you the likelihood that you will achieve this gain if you carry out the optimal therapy. Another way of showing the same thing in terms of the benefit is this. We already saw this picture. If there is short-term benefit only, this is a situation where you have the yellow curve. So whatever you do, you will always end up in the virtuous cycle in this case. And this is around performance level around 46 or so. If it was the vicious cycle, this yellow distribution would be at low values of performance scales. If we have a situation where there is long-term benefit, this is where we have a state corresponding to the vicious cycle and a state corresponding to the virtuous cycle, the two green curves. And the point of therapy is that what we will see is a significant increase, especially if we do the optimal therapy, in the probability that we are here. So the likelihood we end up in the vicious cycle will decrease. The likelihood we end up in the virtuous cycle will significantly increase. What we can also do, if for some reason we want the therapist to have the ability to influence certain gain parameters, we can then show to the therapists what would be the effect of small deviations or significant deviations from the optimal therapy. So what we could do is we could say, what is the change that you will see in terms of the probability of recovery if you make a change of a certain value to one of your parameters, keeping the others fixed at the optimal values. And then you can do this for the different parameters of a game. Here it's shown for frequency, duration, length of a session, whether or not a game one is a given percentage of the full therapy session. So the therapist would also see what is the impact of deviating from the recommended optimal therapy.